Domestic violence can affect anyone at any age. Unfortunately, this is a very real problem in our country and community. To put the severity into perspective, the National Coalition Against Domestic Violence posted in 2015 that over 40,000 domestic violence reports were filed in 2012. Although many people were able to seek refuge in a shelter, 23,000 of those were unable to. And throughout our country, every 15 minutes a call comes into the domestic violence hotline. Being abusive can sometimes come from environmental factors. The Mayo Clinic says that a person's risk of becoming abusive increases with a history of being abused as a child, a current family crisis or stress to include single or early parenthood, caring for a developmental or physically disabled child, poor understanding of child development or parenting skills, substance abuse, mental illnesses like depression or PTSD, financial stress or unemployment, and being isolated from friends or family. When we talk about domestic violence and abuse, there are 4 major categories we need to address. Farkalis outlines emotional, physical, sexual abuse, and neglect. Emotional abuse attacks the psyche of the victim. Physical abuse entails using hands, feet, or other objects. Sexual abuse uses sexual acts and power to control. And neglect is denying your victim of basic needs like food and water. It is very important to note that these categories are not specific to one age group, but can be used as means of control to power other persons. Although mostly seen in the emergency department, cases of abuse can also be recognized in clinics, physicians' offices, and in the psychiatric setting. Since reporting rates are not very reliable, it is paramount for patient safety that all RNs are aware and observant of these signs and symptoms. A lot of times, we will not witness the abuse firsthand, so we need to be vigilant with what we observe. The overall demeanor of the patient will clue us in on suspected abuse. Look for timid or powerless behaviors, never making eye contact, stories that do not line up with the injury, unexplained trauma to the vagina or rectum, sexually transmitted infections, an unkempt attire, malnourishment or an eager to eat, bed sores, and urine burns. It's also important to note that financial abuse is a concern of elderly patients. Signs can be overly concerned with finances or even a sudden transfer of property. This is especially important if the patient is not mentally capable of such transactions. Take a look at the cycle of violence on page 340 and kind of get an understanding of what that is. As nurses, we do need to remember we are mandatory reporters, so we must follow agency protocol if we do suspect abuse. In the event you encounter a victim, you need to ensure first and foremost you provide thorough care with confidentiality and a non-threatening demeanor. Encourage the patient to talk about what's going on without interrupting them. Ask them about the children and how they are coping, and assess their safety plan if they have one. Keep in mind that the National Coalition Against Domestic Violence states that 72% of all murder homicides involved an intimate partner. So when a person leaves their abuser, it's imperative that they are careful throughout the whole process, and they may not be ready to seek help at this time. We need to give them information that can be hidden easily or can be memorized, and know your community resources. This wraps up the presentation on domestic violence. Thank you for listening and have a great day.